Today we're going to talk about how important it is to go to doctor's appointments with your loved one. For all of us, it's great to have somebody with us. We all hear things differently, we interpret things differently, and information can get forgotten, but especially when it comes to going to appointments with our elderly parents, it has the potential to stop a medical mistake. Today I'm going to start by telling you a short story about what happened to us. Before we continue, I just wanted to quickly introduce myself. I'm Tammy Provenzel. I'm a dementia certified physical therapist and a life coach. And I wanted to emphasize that the videos that I make are separate from my role as a physical therapist working in short-term rehab and long-term care facilities. I've been working with elderly patients and their families for 20 years. I see the struggle, especially in the role of caring for our parents. There's a lot of emotions that are involved in that. So these videos are part of my effort to bring information and strategies to the families that are struggling with how to care for their aging parent. Over a year ago, my mom, who was close to 90, had a heart valve replacement. At her follow-up appointment, the doctor noticed that her heart rate was a little bit high, so they wanted to lower it. They started her on a very low dose of a medication. They gave us instructions to write down her heart rate for 2 weeks' time and then call back with that information, and they would guide us further. So we did that. After the 2 weeks, we called with the information back. For the most part, her heart rate wasn't lower at all. So we gave that information, and the receptionist called us back and said, "The doctor says everything looks great. Keep doing what she's doing." And so I asked if the receptionist would please relay a message to tell the doctor that she actually wanted it lower, high 50s to low 60s maybe. And we got the return call back saying the doctor wants her to take 4 times the amount of medication that she was taking. To me, it was almost like they forgot the dose that they had prescribed. So I asked the receptionist to again relay a message to the doctor, reminding her of the dosage she's taking now, and did she want us to truly quadruple it. We got the return call back saying, no, definitely don't do that. Double the dose, and then we'll see how that does. In my mind, that had the potential to really do damage. Her heart rate could have gotten so low that she passed out. It could have gotten so low that she fell and broke something, or she could have died. So I was really glad that we used this strategy that we're going to talk about today. So the strategy is to find a way to document the information you're hearing in the doctor's appointments. It's actually legal in the United States to audio record doctor's visits, but most doctors don't like it, so they won't allow you to. So what we do is we either write it out or we use our phone. I use the Notes app on my phone, and as the doctor's talking, I'm typing in dosage, the reasoning, how long to do it, any special instructions. That really helped us during this appointment because I pulled up that note. What we also do is we keep a binder with a record of conversations, doctor's appointments, hospitalizations, all of that stuff, so that we can look back and see what happened when, and it gives us a good story of kind of what happened over time. So in this particular case, we were able to keep mom safe and prevent a medical mistake. But I think it happens a lot. I think things like this happen a lot. And as someone who works in the healthcare field, I see it happening a lot. And I think that we as caregivers, if we can figure out how to work around some of this, we can help to keep our loved ones safe. Hopefully this video was helpful. If it was, please like and share it with anybody you think might also find it helpful. Put any comments in the comment section below, including strategies that you might use to kind of prevent medical mistakes from happening. Thanks.